COVID-19 has ravaged the health of millions, but it could have an especially devastating impact on women worldwide. I'm Rachel Sherman, a reporter at Coda Story. Here at Coda, we connect the dots between seemingly unrelated stories. And the question I want to explore today is, what effect will the pandemic have on reproductive rights? Lockdown measures have been essential in reducing the spread of COVID-19, but the UN estimates that the pandemic could lead to an estimated 7 million unwanted pregnancies. From Poland to Peru, women have long faced restrictions on access to safe and legal abortions. And conservative movements and religious groups have long weaponized family values in order to push forward anti-choice legislation. The coronavirus crisis has enabled these groups to mobilize in new and effective ways.
During the COVID pandemic, what we're seeing is not necessarily a new agenda, but an effort to exploit the pandemic and the weakened health systems to push an agenda that's long been in place, which is to reduce, to prevent, to roll back access to reproductive freedom of all kinds.
Take the United States, for example, where conservative movements immediately used the virus to restrict access to terminations, declaring abortion services non-essential under the excuse of a public health emergency. 11 states have tried to limit access to abortions. Ohio was the first state to send letters to clinics, immediately ordering them to stop performing elective surgical abortions. Texas quickly followed suit, as did Oklahoma, Tennessee, Louisiana, Alabama, Arkansas, and Iowa. Some states forced clinics to close altogether.
What we're seeing from movements that oppose reproductive freedom is at a time when we need our healthcare access the most, their agenda is trying to take it away.
Now, we're noticing the same trend around the world. In Poland, the parliament has tried to push through legislation to eliminate already restricted access to abortion. In the past, women could travel to neighboring Germany or Slovakia for the procedure. But with lockdown in place and borders closed, women in Poland are left with limited options. Even if they could get to Slovakia, the health minister has said that he does not recommend having an abortion during the pandemic. This statement came after reports that doctors in the country were canceling appointments. In Latin America, dozens of fundamentalist organizations have put women at greater risk since the start of COVID-19.
We have to consider that 2 million girls under the age of 15 every year get pregnant because they have been victims of rape. Latin America, for example, is the only region in the world where pregnancies among girls under 14 are increasing.
In recent months, 2 conservative political parties in Mexico have lobbied to reverse legal abortion. In addition, they've opposed amnesty measures for women imprisoned for illegal terminations. One of the strongest opponents to legal abortion in Mexico is one of the men closest to the president, Arturo Ferrella, an evangelical leader with around 7,000 churches throughout the country. In Sao Paulo, Brazil, this is the only hospital where abortion is legal, and only if a woman has been raped or in cases of fetal anencephaly, a very rare birth defect. But when the pandemic started, the state suspended legal abortion services, instead converting the hospital into a COVID-19 testing site. With public pressure, termination services were eventually reinstated. In Peru, abortions are criminalized except in cases where the life of the mother is under threat. During the pandemic, the government stated that medical personnel could only assess termination of pregnancy in case the life of a pregnant woman is at risk of COVID-19.
This is about ideology and not evidence. The evidence says that abortion is a safe procedure and that is an essential health service.
With so many countries using the pandemic as an excuse to restrict access to reproductive health care, we wanted to find out if there were connections between movements in the US, Europe, and Latin America.
We have seen some patterns and anti-choice initiatives that are tasted in one country and then they're replicated in another country as a way to block gender equality. We have seen more bills promoted by conservative groups to amend children, family, or civil codes to protect life from the moment of conception. And we are seeing this in Argentina, in Bolivia, in Brazil, in Colombia, in Ecuador, in Paraguay, in Peru, in many other countries in Europe. and in the US.
The International Planned Parenthood Federation has reported that the pandemic has forced closures of thousands of family planning facilities across the globe. Marie Stopes International, a global organization that provides contraception and safe abortion services, estimates that up to 9.5 million women and girls worldwide will be affected by the restrictions on reproductive health care. But it's not just women who will be affected by these stories. The emerging trend in healthcare restrictions will have an impact on all of our lives.